So how did I get this opportunity to subspecialize in radiosurgery? Well, I showed interest in the field. You have to be interested in this. Nobody wants to do something just because it's a good lifestyle choice or something like that. We all work very hard, but we make choices based on our interests, and you have to really be interested in this. You have to be available for consults. I've kind of marketed to you the idea that this is a relatively predictable area, but you really have to, at the drop of a coin, be prepared to send the patient over, see them tomorrow, even though you had something else to do, but to be available, market in and out of your practice, including giving talks, and including giving talks to lay audiences. I know that Dr. Considerations and I are both very interested in educating the lay community because at this point in time, they're very much involved in their medical decisions, and this is important. And so educating them is really helpful in building your practice and in allowing you to subspecialize in something that's so narrow. You have to be a good doctor and provide good medical care and communicate. Again, this generates referrals, and at the end of the day, makes your outcomes better if you consider all of the aspects of the patient's medical care. You have to do academic work, which, again, I think Dr. Considerations has done a fantastic job of being able to capture that. You have to consider the financial and the volume implications of what you're doing. Radiosurgery does not reimburse the same way that, say, spine does, and you have to consider that when you're making these choices and have to be able to make that up in volume. So if you're doing something for which the insurance companies reimburse at a lower level, you have to be able to build enough volume to support and make a case for being able to subspecialize. Importantly, you have to have support. I had support of my department chair when I was able to build a business model for subspecializing only in radiosurgery, and also your colleagues, because if they're not going to be doing radiosurgery, they have to be willing to send their cases to you, and you have to, within your department, build yourself as the go-to person in your practice to send patients to, and then as your own practice goes, to be able to help to mentor others so that they can come up and learn to do what you're doing as well in a succession plan. I put at the bottom can extrapolate because I think these statements really are able to be applied to any subspecialty within neurosurgery that you consider. So why radiosurgery is a career? Well, radiosurgery is kind. You can often help people very much. You can rarely hurt people quite beautifully. Radiosurgery is minimally or non-invasive. There's not a lot of times you hurt people. You almost never hurt people really bad, and a death related to radiosurgery is almost unheard of. Radiosurgery is, as I've said over and over again, elective. It's considerate. You can think about what you're doing and revise things before ultimately deploying a plan. You're not in the situation like you are in the operating room where you have to make these game time decisions as much as you do in open surgery. I put the comment about great for OCD. Well, it's obviously an investigational application in OCD, in obsessive compulsive disorder, but I joke that it's because of the fussiness of radiosurgery, it's really great for somebody that thinks in that kind of way. The technology, why radiosurgery as a career in consideration of the technology. Radiosurgery is highly technical. There's lots of machines. There's lots of radiation physics considerations. The technologies are constantly changing, and there's always something new coming in to make this fresh and interesting. The opportunities are wonderful for interfacing with academic collaborators and with industry to actually drive the technology forward and to help to influence technology development that may really be used for patient care in the future. Why else radiosurgery is a career? Well, it's highly collaborative. It's a true team sport. At the very minimum in the United States, radiosurgery involves a team of a neurosurgeon, a radiation oncologist, and a medical physicist. The multidisciplinary conferences are a fascinating and wonderful way of being able to talk about these cases and talk through them and think through them. In our own multidisciplinary conference, I've made it a rule in conference that everybody has a voice. There's no doctor this and doctor that. Everybody gets stripped down to their first name. Everybody has an equal voice, and the voices of a radiation therapist, for example, that has treated a patient before and said this patient will not be able to be still in a mask for this time, you need to put a frame on, or the dosimetrist that finds something that you find tough to swallow about proximity to a critical structure, for example. Everybody gets to have a voice in this conference, and this really helps to make the conference discussions more interesting, more educational, but most importantly, to improve patient care. Why else? Well, Dr. Considerations mentioned there's a variety of indications that we use in neurosurgery. This is the one field, I think, or one of the fields where we really do span the scope of almost every single neurosurgical subspecialty. Indications for radiosurgery include benign and malignant tumors, some of which I've outlined here, and you saw it in the table that was shown to you by Dr. Considerations earlier. Spine, vascular, we treat a lot of vascular malformations, mostly AVMs, functional, mostly trigeminal neuralgia, and even the rare, at least in my practice, pediatrics case. Why else? Well, this is really an evolving subspecialty as a whole. It's a young field. There's a lot of opportunities going forward for research and publications. There's several important registries that are developing that can be mined for important discoveries regarding indications and outcomes. The anatomic considerations in radiosurgery are really special. The neurosurgeon that does radiosurgery looks at the brain and at the spine from a different vantage point than you do other neurosurgical procedures. So something that might be just completely horrific in an open surgical procedure becomes actually very doable when you consider the anatomy as somebody that does doing stereotactic radiosurgery. The critical structures we look at in a very different way than we do when we do open surgery. The arrow that you see there is pointing at what you all recognize as the optic apparatus, and seeing the optic apparatus on spots like that is really a gorgeous thing when you're working on a case and trying to minimize the dose to a critical structure such as the optic nerves and the optic chiasm. The decision-making process really makes radiosurgery as a career something also really nice. The algorithmic and iterative way that we approach cases, the way that we talk to other members of the patient care team is extremely important and invigorating. And for example, when we look at a spine metastasis case, we really have to kind of answer yes and no to cases that come at us. So all the time, other members of a care team will come at us with opportunities to do radiosurgery. You have to kind of think about them in a yes or no strategy, in an algorithmic way about what's okay and what's not okay. So somebody says, I have a patient who I did decompressive surgery, there's a tumor in the vertebral body, can you treat that? Yes. Can you help my patient with a painful vertebral metastasis from a pain doctor? Yes. The oncologist says, I have a patient with a well-controlled lung cancer, they have a single vertebral body metastasis, that's a yes. I have a patient from the radiation oncologist that they say has had fractionated radiation to their spine, and now they have a small recurrence without epidural disease. Can you treat that patient? Yes. And then somebody comes at you and says, can you treat my patient whose legs aren't moving, and you see a scan with high-grade spinal cord compression? Can you do that? No. So a couple of other interesting considerations that people might not think about. Well, your malpractice costs may be lower. Malpractice for neurosurgeons is extremely high, higher than almost every other surgical specialty. And actually in my practice, because of the limited scope of my surgical practice, I've been able to make the argument that the carrier should actually charge my department less for me as a neurosurgeon than others, which kind of lowers the burden of carrying my practice in my own department. So I set up this column here just as we start to wind down in considering if you want to do radiosurgery as part of your neurosurgical career or as a neurosurgical career, as I've chosen. So in the thought of why do radiosurgery as part of your neurosurgical career, well, arguably you'd be more well-rounded as opposed to me, who's kind of a one-trick pony, very focused on one way of doing neurosurgery. If you do it as a part of your neurosurgical practice, you can take patients from surgery to radiosurgery, your own patient, with essentially out-referring them to another doctor, whereas my practice requires that I depend on referrals from other neurosurgeons in my practice, in addition to, of course, the outside cases that I get from oncologists or radiation doctors, et cetera. Maybe if you only do radiosurgery as part of your career, you have more insight into the whole picture regarding the patient, whereas I may have more expertise in a very small area. as doing neurosurgery with radiosurgery as part of your practice. You can say, well, I do it all, where I say I market it as a subspecialist, that this is what I do very well and I think about day and night. In doing it as part of your career, open neurosurgery, as I mentioned before, you may be compensated better rather than if you do radiosurgery alone, unless, of course, you can drive the volume up for both to a level where radiosurgery is an accepted fold-in into your open neurosurgery career. But on the split side, radiosurgery alone may give you more flexibility in your scheduling, and that may have a cost.